Welcome to the COVID-19, the basics, with an update and understanding of COVID-19. Welcome to our first official town hall. My name is Mia Williams. I will be your moderator for today. We have some amazing speakers that will be informing you about vaccinations and COVID-19. So please let us enjoy this informational session. This is going to be one of four town halls that we will be presenting. In advance, I would just like to thank everyone for their participation today. And of course, our partners at the bottom, the Southern Jersey Perinatal Cooperative, New Jersey Health Department, COVID Project, which is us, a collaboration of Boys and Girls Club of Atlantic City and the CDC, and AtlantiCare for all of your partnerships. In addition to that, I'd also, of course, like to thank Mike Heck for all of his assistance with putting this together, Dr. Washington for all of your fantastic information that you're going to share today. In addition to that, Dr. Hocbo for all of your vaccination information you're going to give us today, and Miss Allen for your personal story that is absolutely touching, and I hope motivates everyone to go and run and get vaccinated. So without further ado, I would like to present Miss Vanita Allen, a community member of Atlantic City, correct?
Summers Point, Atlantic County.
Summers Point, okay, of Summers Point. And with that being said, please, Miss Allen, take it away. I'm going to stop sharing my screen, everyone, so we can all see Miss Allen's lovely face. All right.
Well, first of all, I want to thank the host for allowing me to give my opinion and my decision for getting the COVID-19 vaccine. I would like to first discuss the reasons why I decided to get the vaccine, and also the reason why I was a little hesitant about getting the vaccine at first. Like many people in the communities of color, there is some health issues that are underlined in our community. I'm one of them. I have high blood pressure. I also have chronic lung disease, which has come from being an asthmatic, scar tissue that has built up on my lungs. I am BARC, BRCA2. I carry the gene along with my other family members. We have a family history of diabetes, heart disease. So the vaccine was very important. When I first heard about the vaccine, I was excited that there was going to be something that basically could help, cure, well, not cure, but kind of slow down the rate that the COVID was going. I just want to give you a little bit about my background also. September the 18th in 2013, I was actually put on life support. I had a severe asthma attack. I had many triggers that day, which I was cleaning with bleach. I had also went to the dentist, and I'm latex allergy. I have an allergy to latex, and I went to the dentist, and I just was feeling out of sorts. So I went home and I took a nap, and I woke up to my daughter actually yelling, "Mom, get up, you're having trouble breathing." And when I went to sit up, I couldn't catch my breath, which then resulted in my daughter calling 911. I went to the hospital. Now, I don't remember at all going unconscious and being put on life support, but I do remember when I was conscious several days later and being taken off of life support, was something that I never, ever want to experience again. Having that feeding tube and life support come up out of my throat, I was just like, oh my God, I had never known that I hadn't been on life support, and I never heard anybody talk about coming off. So when I actually heard about people who had COVID, many people having to be put on life support, I was like, oh my God, I don't ever want to go through that again. So I need to find ways to protect myself from getting the COVID. So the only thing that became, when I found out they were doing a vaccine had came out, but when I found out they were offering it to the elderly and people of color, because basically that was the group that was having the most trouble dealing with COVID, I became hesitant. basically because we do have a history in the United States of people of color being, basically used as human guinea pigs. So I'm like, no, there is just no way I'm going to take this vaccine. I'm going to wait. And I'm going to wait to see other backgrounds receive the COVID-19. I want to see government officials receive the vaccine. And I want to see Dr. Fauci receive the vaccine. When I started seeing this, I became more comfortable with the fact that, okay, I'm seeing other backgrounds besides people of color and the elderly get this vaccine. And then I felt comfortable enough to make an appointment and schedule for me to have the vaccine. That's basically my story and why I decided to get the COVID-19 vaccine.
Ms. Allen, thank you so much for honestly your personal journey with deciding to get vaccinated. Honestly, I appreciate your honesty because I also have asthma, and it was absolutely one of the deciding factors for myself to get the vaccine as well. It really was. All right. So with that, I am going to hand off the microphone to our next presenter, who is Dr. Washington. Dr. Washington is the Director of Health and Human Services for the city of Atlantic City. So Dr. Washington, are you ready to share your screen? I've made you the co-host.
Yes, I am. So indulge me just a second. Let me see if I can get my presentation up and running. Can you see my slides yet?
Yes, we can.
Okay, let me go one more step, and I'm going to get fancy on you now and see if I can go to another step and see if you still can see it. Can you still see my slides?
You sure can. You mastered this one. I love it.
Okay, all right. It's a pleasure speaking with everyone today, and it's an honor speaking to not just the general audience, but communities of color. So today, my focus is going to be on the pandemic itself, COVID-19, the virus, the pandemic itself, and the true impact on communities of color. And so Ms. Vanita gave us a great testimonial, because you're going to find in my presentation, you're going to hear a lot of things that she talked about. And of course, this is my first day meeting Ms. Vanita. But hopefully, because you're going to hear some of the same things, what I have to say very quickly today will resonate in you and really give you the fire you need to run out and get the vaccine as soon as it's offered to you. What we've been dealing with on the public health side is three things: no information, misinformation, and disinformation. So I've always learned that in order for us to know why and where we're going, we have to first start by understanding where we started. So I'm going to talk with you about some things that if you don't know, after today, now you'll know. Did you know that this is a novel virus, COVID? This infection is primitive in nature. And primitive means it's been around a long time. May have been called something else. It perhaps mutated from something else. It's not an advanced virus, by the way. And what makes us know that is this virus cannot replicate on its own. And that's based on the genetic material and the structural composition of the virus. That's going to be important because it's going to drive why is it we are pushing so hard for people to wear the mask and to get the vaccine. In April of 2020, there was no vaccine. Today we have one. In March of 2020, there were 8 different variants or strands of this virus. Today, there are many strands, but there are 4 or 5 that we target because they're very contagious and can really cause havoc in our communities. Unlike the severe acute respiratory syndrome virus, SARS, COVID-19 has multiple spikes. That's that thing that we see on TV. It's not as pretty as it looks, by the way. So if you can see this slide with all the little spikes, it's not that pretty, it's ugly. This virus, though, can stick to many surfaces, including stainless steel, something that slick. It can stick and hitch a ride. although it can be spread by droplets, we learned later on that it can be spread by airborne. And so we've also documented that from a human sneeze, it can travel up to 27 feet. Of course, you've heard that social distancing 6 feet. Just know that it can go a lot longer, a lot farther in the air. And this virus mutates based on coming in contact with your red blood cells. I'll talk about that in a little bit. Back in the end of 2019 or early 2020, the International Committee on Taxonomy of Viruses named this virus COVID-19 because it started in 2019. That's why it's COVID-19. It became a pandemic because there is a difference between an epidemic and a pandemic. Because of the rate of spread, there was over 118,000 cases. There was an increase 13 times what they found in China when it first started, and it spread to over 114 countries, causing over 4,000 deaths. That's when it was labeled a pandemic. The first case was in China, as we know, and what makes this virus unique is that it can cross over different animal species and barriers. The incubation period has been 3 to 7 days, up to 2 weeks. On average, some people can go as on average about 12.5 days before they see the first symptoms. Early on, we had 2 therapeutic strategies. They were supportive in nature and preventive in nature. That was the testing, the diagnostic, and that was the prevention strategies through social distancing and isolation. Here's the transmission cycle. This is here just to show you that this thing is primitive in nature and it's gone through animal to human and then through incidental host transfer over to other humans. So this thing can go in an animal, out of an animal, back to a human, back to an animal, back to a human. That's where all these variants are coming from. We know the structure of it. Although it's microscopic in nature, the structure of it, what's important here to remember, those little spikes that we see on this virus, we call them spike protein, has a lot to do with the messenger RNA. The doctor, the other members that's going to talk about, is going to talk about that. But what's important here is the COVID testing looks for this double positive RNA. And so that either the test that you do to see if you have COVID, they're looking for a double positive RNA. And also the spike protein that's captured, I call it a blueprint in the message on the messenger RNA. And we've got 2 vaccines out there, the Moderna and the Pfizer BioNTech, both use the same technology. The message, the blueprint is of this spike protein. That gives your body the muscle memory so that it can attack this virus should it show up in your body. I wanted to put this slide in and talk about why is it we keep talking about something we can't see that can spread. We call these events where a lot of people come super spreaders. Well, this slide is here to show you how this thing can spread. One adult can infect an entire community. One adult. What the science has shown us is that most of the spread happens with children, teenagers, adults. And if you look at this slide, most of the colors you see starts with the purple with an initial spread, and it's exponentially spread with children, teenagers, and adults, because many of them don't even carry symptoms. They're asymptomatic. That gets us to Atlantic City. Atlantic City is a very diverse city, a lot of communities of color here. African Americans, Asian Pacific Islanders, Bangladesh, Hispanic, Latina, and others. This virus, I call it the invisible enemy for communities of color, because our death rate in communities of color is double or more of the death rate of other races. So please keep that in mind. I also call it the 21st century kryptonite, just like Superman. This virus can bring us to our knees. Vanita told you that it brought her to her knees and she woke up in the hospital. It's the perfect storm for communities of color, primarily because of the olive skin color that we carry. I use the word melanin because that reflects to the black pigmentation. Our black pigmentation is a positive and a negative for us. It protects us from the sun, but it also keeps us from absorbing vitamin D3 and other things that help to boost our immunity system. So as a result, the majority of us have a low immunity system across all communities of color. In addition, our kids have grown up in an environment where we keep them in the house. They don't go outside a lot. They play all these games in the house. So they're not getting a lot of the sunlight. They're not getting a lot of vitamin D. Guess what? Their immunity systems are low. That puts you in a compromised situation. Vanita mentioned some of these other things. Why is it that this virus is truly attacking the communities of color? It is because of these underlying risk factors. Things like obesity, which is common in our race, high blood pressure, hypertension, kidney disease, asthma. I believe Anita mentioned something about lung problems, diabetes, congestive heart failure, HIV and AIDS, smoking, and other autoimmune responses, autoimmune diseases. These are underlying risk factors that make coronavirus the kryptonite for communities of color. I looked at the death rate today, and I'm certain that the other speakers are going to talk about this. As of today, and we have some pretty high numbers in the United States, we've lost a lot of folks in the United States from this virus. It's come through our communities and wreak havoc on our communities. It is a leading cause of death in the United States as of today. Over 31 million cases, roughly 32 million cases of COVID infections as of today, wreaking over 570,000 deaths. There's a lot of empty tables around America because of this virus. But notice who's dying. 60% of that 570,000 people are non-Hispanic white. Now, I know you're going to be confused a little bit because you see that roughly 15% are Black and African Americans. But you got to keep this in mind. Black and African Americans, we only make up 13% of the population. So proportionally, our death rate is much higher than the other races. This is what you got to keep in mind. What can we do? Since we have the vaccine, we shifted our methodology or our strategy to a control strategy. We have mitigation strategies and suppression strategies. And mitigation strategies we talk about all the time is the social distancing, isolation, quarantine, travel restrictions, which are starting to be released a little bit for those that are vaccinated. And then the suppression strategy. This is important because suppression means you're bending that curve. How we suppress it, we find out where the virus is, who's got it by testing. We get those people isolated. We do contact tracing on those people, and then we treat them. We take them through a process where they're either antiviral treated or if they resolve the encounter with the virus and they extend a period of time after that, we can give them the vaccine. You don't want to get to hospitalization. That's a suppression strategy as well. But to get to hospitalization, I would say Vanita's lucky. That's a great testimony of Vanita, because when you get to hospitalization, you have to go on ventilator-assisted treatment. That's a bad deal. So what can we do? Well, we know how to kill it. We can kill this thing. There are things like ethanol, chlorine containing disinfectants, and peroxide. These are safe things. They can be found around your house, easy to get. Nothing real fancy. There's a reason why you can kill it. And that's because I showed you the structure of it. It's got a little lipid layer on it. That's synonymous with like a fatty type of tissue. So this ethanol and chlorine and peroxide can break that fatty tissue. In order for us to kill this thing, we have to break the integrity of the structure so that we can kill it. The other things, we stay at home, we wash our hands, avoid contact with large crowds or sick people. We keep our social distance. We clean our internal, external environments and avoid cruise travel if you don't have to, but they're starting to open that back up too. What is America's #1 strategy? Get vaccinated. As of today, over 235 million people in the United States had at least one dose. We need to do better, especially in communities of color. And with that, thank you so much.
All right. Thank you, Dr. Washington. For those that have tuned in after, the voice that you're hearing is Mia Williams. I am STEAM Director here at Boys and Girls Club of Atlantic City. Before we move on to Dr. Hocbo, does anyone have any questions for Dr. Washington? No? Yes?
Thank you so much. I'm sure the other speakers, I'll stick around and we can all answer questions.
Absolutely. All right, so Dr. Washington, I'm going to stop you from sharing your screen as you did. Thank you so much. And I am going to share my screen to bring up Dr. Hocbo's slides. All right, here we go. Share.
Hi, Mia, I can share my screen.
Oh, okay. Proceed, Dr. Hocbo.
Oh, but you have to make me a co-host.
Yes, ma'am.
Oh, so hi, good afternoon, everyone. First of all, I'd like to thank Mia and the rest of the people that have organized this event. This is kind of has a special place in my heart. I've been working here in Atlantic City for the past 10 years. I've been dealing more with patients that are hospitalized. We've been through a lot over the last year. We've been to a part when we don't know what's going on, that we're struggling and trying to figure out, where we change our recommendations every week. But now we have trusted science, and now we kind of know what we're doing. There's still a lot of uncertainty, but now we have more guidance of what to do next. I've seen it all. I've seen it like people that are really struggling here in the hospital. I'm telling you, this is one place if you have COVID, you didn't want to be in the hospital. So I just want to share with you guys my screen. So let me know if you're able to see my screen.
Yes.
Okay. So, Dr. Washington had went through these numbers already. This is very specific for New Jersey. But I want you guys to remember, these are not just numbers. These are people's lives. Every people here, every confirmed deaths that we account for, there's a daughter, there's a son, there's a mother, there's a father that's grieving. So we have to do something about this. I want to thank all of you for doing everything you can to mitigate the spread of this virus. You've done a lot. You've done the social distancing, you've been wearing your mask, but now it's time for us to take the next step. So right now we have 7 variants of the COVID-19 that are identified in the United States, and they're also present in New Jersey. This is just a graphical representation of the cases within New Jersey. We want to make sure that we emphasize that we wear our mask properly. So we have to make sure we use 2 to 3 layers of cotton or cotton mix, proper surgical or procedural masks. Again, we do not recommend bandanas, neck gaiters, or masks with exhalation valves. We have to make sure that we have well-fitting masks, that it covers the mouth and the nose. So currently we have 3 vaccines that are approved by the Centers for Diseases and also by the FDA that is available to all of us. We have the Pfizer, Moderna, and we have the Johnson & Johnson. So the Pfizer and Moderna uses the technology we call messenger RNA, and the Johnson & Johnson, we have the technology that we call viral vector. We'll go through it in a little while. Pfizer and Moderna requires you to have 2 doses. For Pfizer, you have to have it 3 weeks apart. For Moderna, we have to have it about 28 days apart. Why is it important to make sure that you have the 2 doses? The first dose is kind of getting your body used to getting the immune system. And the second dose is to give our body a booster shot, what we call a boost of our immune system to be able to fight the virus more effectively. So I'm just going to go over, slide up. So this is the technology that we use for messenger RNA, for Pfizer and Moderna. This technology has been present for a while. This is something that's new. Scientists have studied this for years. However, this is the first time that we're using it for a virus, for a vaccine, sorry. So what this messenger RNA means, as Dr. Washington had stated earlier, this virus have this kind of spikes. And these are the memory cells that we want to kill, or we want to make sure that our body recognizes, so that when the true virus comes in our body, that our body will remember, oh, I already know this virus. Now I have to fight it because it's not good. So this vaccine will not give you the virus itself. This is another technology. So you're not going to get sick of the virus. So that's one thing. You're not going to get sick of the virus. The other thing also with the messenger RNA is that a lot of people have been asking, since this is some kind of cool technology, this is a new advancement, will it affect my DNA, the way how I look or the way I function? Definitely no. As you can see here on this part, after the vaccine does its job of making sure that your body will be able to recognize COVID-19 virus, it has like self-destruction. So if you've seen Mission Impossible movies, you have to press a button after Ethan Hunt is able to get his mission. Whatever it is there, it just disappears. I don't know, Dr. Washington, you're kind of agreeing with me. I don't know what else I can
Yes, that's more, good.
Something that everyone would understand is that how it is. After the vaccine does its job, it disappears, it gets destroyed by the body. So there's no way that that vaccine is going to affect any other parts of your body. Any question about that? About the Pfizer and Moderna's technology of how it protects us? Now we go to the Johnson & Johnson ones, which is the technology that they uses is called vector vaccine. So instead of this cool technology of having something, messenger RNA, to make our body realize that this is COVID-19, what the vector does is it uses other, it uses other virus, not the COVID-19 virus itself. So the same thing, you're not gonna have COVID if you get the Johnson & Johnson vaccine, because we are not giving you the COVID-19 itself. We're giving you another harmless virus for your body to realize that I have to fight COVID-19. So again, after the body is done, I recognize this might be COVID-19, I'm done with it. This virus that we injected in you is gonna be gone. It's done its part. Again, like Mission Impossible, self-destruct. Okay. Any questions about how the technology of the current available vaccines that we have? So this is just a table of the differences between the Johnson & Johnson, Moderna, Pfizer. So just to reiterate, Moderna and Pfizer, we use the messenger RNA. Johnson & Johnson is a vector vaccine. Johnson & Johnson, one shot, you're done. Moderna and Pfizer needs 2 shots. Again, all of these vaccines are effective. They have different percentages of how effective they are. But I want you guys to be mindful that do not look at the numbers of the percent of effectivity. because these vaccines have been tested in different times in different populations. Like Moderna and Pfizer were tested before the new variants come out. So Moderna and Pfizer cannot say that I'm affected with the new variants. Johnson and Johnson are effective in the new variants because they were tested with the new variants. So what is important here is not the percentage of effectivity. What is important here is that it will help us. It does prevent COVID-19 infection, and the most important thing is it prevents severe cases of COVID-19 and actually prevents hospitalization. And that is one thing that we want to achieve. Normal side effects, anything. Everyone, you might have gotten your flu vaccines, or when you were a kid, you got like every year of vaccination. The usual side effects: pain, swelling, redness, or swelling of your lymph nodes. Sometimes you might feel tired, you might have some headache, muscle pain, chills, joint pain, fever, nausea, or feeling unwell. It means that your immune system is working and trying to make those memory cells so that when the real virus, the real COVID-19 virus comes in, is that they'll be able to remember, I have to fight this. This is not good. And I have all the resources I have to be able to fight this COVID-19. I just want to talk more about the headache a little later, especially if you had Johnson & Johnson. So worldwide, we had given 973 million doses. But however, even though this looks like a lot in the millions, it's only 2.9% of the population that we've been vaccinated. Here in the United States, we only are able to vaccinate 27.2% of our population. And specifically in New Jersey, we only have 32.4% of our population that are vaccinated. Specifically for us in our Atlantic County, we are very blessed that we have a mega site within our county, and we're able to provide a lot of vaccination for everyone. Everyone that's age 16 and up are now eligible to get vaccinated. We've given 201,000 doses already. So now there's a couple of things that's been going on. Why do we have a lot of people that are not yet ready to get vaccinated? Some of the things that have come up during our open forums or community outreach is there's a lot of uncertainty. Uncertainty about the science. Yes, I do agree. There's a lot of uncertainty. I've dealt with uncertainty in the beginning of this pandemic. I don't know what I'm doing. But I think now that we've learned more about this vaccine, now we know that these vaccines are effective. It's time for us to take our part on how we can make our town, our county a better place. Another one is distrust in healthcare. And I think Ms. Allen had expressed her feelings about distrust in healthcare, especially for people of color. And it's okay to feel that. But on the other hand, now we have a lot of resources for us to be able to get more information. And if you have any questions or any concerns, that's why we're having these sessions. That's why we're having our resource persons for us to be able to answer your questions and to at least whatever we can so that we can help for you to trust us, the healthcare system. Another one is distrust in government. One thing that I want you guys to remember, it's not the government. Our enemy here is the virus. It's COVID-19. It's not about having different political views. We have to focus on one enemy here, and that is the virus. The other one, as Ms. Allen has also stated, about history of experimentation. These new vaccines were done and manufactured without using any human tissues. human embryos. That's one thing also that has been coming up. But when we've talked to all of this and reviewed all the literature, they're not using any human tissues in the development of any of these vaccines. The other one is conspiracy theories. A lot of things is going on that, this vaccine is gonna the government's gonna be able to track what I'm doing because it's going into my DNA, which is like the map of what kind of a person I am. None of these vaccines will ever go into your DNA. As I stated earlier, these vaccines will just self-destruct after it's done its job. And the unknown. Yes, there is a lot of unknown. I myself have a lot of unknown with this virus. We're dealing with it as we get more information. But what we know so far is that vaccines work. And it saves lives. The other thing also that was asked about us is how are we able to approve these vaccines so fast? So the FDA and the CDC and this expert panel have to act fast. Why? Because we have a lot of people that are dying. We have to do something now. We cannot wait for years before we're going to be able to fight this enemy, before we're going to be able to fight COVID-19. But it doesn't mean that we fast track it without making sure that we take all the precautions or making sure that this will be safe for the people. So as of right now, everyone in the state of New Jersey, age 16 years old and older, are eligible to get vaccination. As I said, our Atlantic County mega site in the convention center is open for everyone. We're not going to be asking you for proof of for your identification or anything like that. As long as you're eligible, we want you to get vaccinated. Use trusted resources. I know there's a lot of things going on in social media, but we have to make sure that we validate or we check what we're reading in different social medias. So always check the CDC, the FDA website, and ask your doctor, ask your community leaders. I came from the Philippines, and you guys have seen what's happening in India right now. They're having a surge. A lot of people are dying. Yes, we are very lucky here in the United States that we have the technology, we have the infrastructure to be able to give these vaccines in such a short time. And I think we should all take advantage of this opportunity that we have. I think I talked about these things. Again, for prevention, hand washing, very important. Avoid crowds, maintain social distancing, always wear a well-fitting mask, and get vaccinated. Now I'm going to open it to questions. Any questions that you guys have?
All right. Thank you so much, Dr. Hocbo. Honestly, I've personally learned a bunch, like going through your slides as well. While we're here, I would like to do two things. If you don't know, if you're participating for the first time, obviously you all are, with the COVID-19 project, I want to take a second to introduce our community educators. So currently on the call, we have Mike Davis. Mike, if you don't mind waving, that's Mike Davis. He's one of our community educators. We also have Chloe Chang over there. We have Michelle Escato. We also have Cara Janae Peak. And these are community young people that are educated in COVID-19. There's an email address that I'll give you guys toward the latter part of this so that you can reach out if you have questions. And they are absolutely here to to advocate for getting vaccinated and to also just give you information and education that you may need as well. In closing, what I'd like to do is show you guys our COVID Ed website. In addition to that, we have one video testimonial from one of our other community leaders. Chef Pam is our executive chef here at Boys and Girls Club of Atlantic City. So I'll just share that and then we will wrap up. Yes, Ms. I'm Dr. Hocbo.
Yeah, I just want to say something about Johnson & Johnson. Johnson & Johnson is, again, approved for use for anyone 18 years old and older. The government had to put a pause because it's part of being very cautious to make sure that we have checks and balances. But after all the studies that we've done, the risk of getting COVID-19 is still higher than the risk of having a blood clot. Just if you decide to get Johnson & Johnson because it's easier, it's one shot, make sure that you monitor yourself if you have any headaches, abdominal pains, leg pains, or shortness of breath, is that you come to your healthcare provider as soon as possible. The blood clots is something that we can treat, but we have to treat it right. So you have to come and seek medical attention at once if you have the side effects with Johnson & Johnson.
Hi everyone, my name is Chef Pam Green. I'm the executive chef here at the Atlantic City Boys and Girls Club. My relationship to Atlantic City goes back well over 25 years. I've been a chef in the city, various casinos. The last property I worked at was the Sheraton here in Atlantic City for 18 years. I moved to Atlantic City last May. I live on New York Avenue, so obviously I love this place. I was asked why did I want to talk about why I got the vaccine. Well, first of all, I'm working with over 100 kids every day, so it's important to me that I know that I'm safe for them. I also have older siblings in my family. I want to be safe for her. I want to be safe for my grandchildren, my family, my friends, the people that I love, even the people that I don't love and I don't know. I got my vaccine at AtlantiCare right here on New York Avenue in Atlantic City. It was a seamless process. Everyone was very nice. I walked out of there the first day with just a sore arm the next day. 2 weeks later, I went back and got my second shot. I was sore and a little achy the next day. I came to work. Really, it was a non-issue. I feel very confident that what I did was for the right reason, for many, many reasons. I'm happy I did it, and I would recommend that everyone get vaccinated.
Next time, you can bring your friends and your family to join us on this crusade to fight COVID across the 48 blocks of Atlantic City. We are a community, and this is our way of helping to take care of our neighbors and our friends and our families. So we hope you will join us and spread the word to your friends and family for next time as well. All right. A great thank you to Mia Williams of the club. I think she did a phenomenal job. Everybody stay safe out there. We appreciate you.
All right. And take care, everyone.